Okay, so I'm going to stop there. Just like to hear a reflection from our presenters. David, reflections, please.
I think it's absolutely great, the material that my colleagues have presented, which both give an overview and also very specific examples of how things could be tackled. I don't think there's a lot I want to add to that, other than to say I think it's really important for people to exchange information. I mean, you were sharing, Jim, a couple of examples from the UK, but I think so often we work within our own bubbles, and there's so much learning that we could have by hearing from people who are doing similar things in different countries, different situations. And you know, we've the links are there potentially for people to share such stuff, because we can then disseminate it as well. I think it's really important and valuable.
Christine.
It was a pleasure to listen to these concrete examples of how we can strengthen our efforts for loneliness, but also community empowerment. I know my own presentation was much broader, kind of setting the scene, but as Nikolai was highlighting, loneliness is even is more worse than smoking, and it says something.
I think we've temporarily lost Christine. I think she's frozen. Nikolai, would you like to comment?
Yes, first of all, nice presentations, and it's always a pleasure disseminating and sharing knowledge in this European network, because we are so alike yet so different. But one overall reflection is actually one that I forgot to mention in my talk, that there's sort of another outcome of all these things if we achieve them, if we get a higher level of health literacy, if we get a more social sustainability, sustainable system and so forth, less loneliness and so forth. And the one of the most important outcomes is actually that in activating citizens, they help us shape the system. So it gives us a very important feedback loop. The whole question of what matters to you is so important to get embedded in our way to communicate, because this is the way we sort of change the system. I don't think it's the politicians or the very powerful members of society that suggested that we should test 4-day working weeks. I think it was us everyday people dealing with 5-day working weeks and a lot of things to cope with, and all these mental stressors in everyday life, and the most radical ideas of how to change society often comes from the bottom up and not from the top down. So if we don't have systems that sort of have an easy access to giving these ideas to us, to the whole society, then we will fail in our missions of all these presentations we saw today. And it reminds me, my background is in philosophy and rhetorics, and especially in the world of rhetorics, we talk a lot about having an easy access to feedback in all kind of communication. And this is actually the same thing we should think about here, that all we do, there should be an easy access to feedback. One of my colleagues said, don't make a website without a feedback button. And just to say that making this channel of listening to people very, very easy to use is maybe one of the main learnings today in achieving these points. Yeah, that was my reflection.
Piera, you've got your hand up. Would you like to, is there anything you wanted to add?
Yes, I want to thank you all, because all the presentation been very, very useful and enlightening. And I also agree with David that we really need to exchange experiences worldwide and in between countries and people, and not just I can say exchange and learn from each other, but also perhaps develop new different ways according to different culture or kind of people. So I really thank you so much, and I want to say that we need to do more and more of this webinar, and perhaps really small meeting online to exchange experience. But thank you to all of you.
Des works for Help and Care down in Dorset, who's some of the material I've just presented of his. So it seems rude not to, Des, just give you a moment to comment if you so wish.
Really enjoyed the presentations, and it's really got me thinking. I think the slides that you've seen there in relation to Help and Care very much reflects our work to gain some traction within the health system, and particularly within GP surgeries and working in primary care, for them to think about their community in a different way, and to empower their community to inform their service provision, and also to empower primary care to reach out beyond the four walls of their surgery and look at the broader community. And it's been very exciting work, but equally it's been very challenging, because I think we need to recognize the work of the medical profession is such a busy one, and particularly at the moment. And I think trying to get people to think differently, to operate differently during an already very busy period, and you know, we've had a really interesting insight into what it's like to for a doctor, for a nurse, etc., on a day-to-day basis. And it's not just about medical issues; there are business issues, there are political issues, there are relationship management issues. So it's a very complex world. So we need to do everything we can to engage primary care with the wider community, and that's our role as a voluntary sector organisation. I think we've seen some great examples, as I mentioned in the comment, in Denmark, and also obviously in Frome, about the community approach. And I think here in Dorset, we need to now start focusing on the community approach in tandem with the focus on primary care. I've had kind of a bit of a reality check this week, because we talk at the scale of change required, and the challenge we have to shift systems to think differently and operate differently. Just this week, I was at our local church, and the priest made an announcement that one of the congregation, who we regard as very connected or well known to us, passed away this week alone. And I think that was a real reality check for us to say we had this perception that this person was connected and networked, but she died alone. And we've had another incident just in the last couple of weeks, which had a more positive outcome of a young lady who delivers newspapers in the area here, realizing after a couple of days that the newspapers were still on the floor on the other side of the door, and called the emergency services. And thankfully, there was a positive outcome from that intervention. So as much as, you know, change is required, we really need to keep it very local as well, and work in tandem with the bigger system change challenges, but also mobilize communities very locally for interventions, for change, and to do everything that Nikolai and the people in Frome have been promoting. Hope that makes sense, Jim.
Yeah, thank you, Des. Thank you. I see there's a further question from Tina around how do we have conversations around what's sometimes very difficult subjects and what have you. And I guess a key thing here is training around how do you train people, might be healthcare professionals and others, to feel confident in having conversations around what's important to people, to what we call building the empathetic bridge between themselves and another human being, and seeing that, not being afraid around asking the more difficult questions. And that requires skill, it requires training, it requires the use of you know, how do you use open questions and reflective listening and those sort of core skills. And you know, we're very keen to see that sort of training much more rolled out across as well. Nikolai.
Thank you. Most of the frustrating communication practices between patients and practitioners stems from frustration from the system. So looking at my man on the bench again, I mean, for him, it can probably make no sense to start calling the doctor, because I'll just get into this very complex system. But if he had a conversation with his neighbor on the bench saying, well, if you contact her, she can help you and you could get through, that might be motivating you. We had a much easier communication situation with that citizen than one who's from start frustrated with the system. So using this power of the people to create better systems.
Okay, thank you. And just a huge thank you to all of our presenters. Please get in touch with us, sort of become part of a community. CEmPaC is completely not for profit. Our mission is purely just to spread best practice and connect people up and share examples of best practice and resources and things. Please feel free to share as widely as possible. The more people are getting involved, the more people are getting connected, the more we can spread best practice and understanding as well. And thank you very much indeed. Thank you.